it's hard to see the end result sometimes because you don't see the food on people's tables, but we know that it's getting out there.
There's always like important efforts to share food with the greater community, whether it's people who are low income or otherwise food insecure.
So this year really I've been just volunteering to deliver to just individuals. The one most immediate need that the food fulfills is to like satiate that physical hunger, right? And so, the type of produce that's grown at Mustard Seed Farm sometimes is expensive or hard to procure in the grocery stores. And so if we're delivering to individuals or organizations who have individuals that have a hard time because of financial resources or other barriers to procuring that food, then that's a huge piece of it, is just feeding them so they're no longer hungry. There's just all sorts of barriers that make people disconnected from the land, and I think that is detrimental to people, to their souls, basically. So if whatever I can do to help like reconnect people with nature and with the land, I'm very happy to do that.
Like the land is part of our lives, whether we like live on it or work on it or think about it or not. So I think it's like, I feel like there are so many things that will exist in my life outside of the farm that will relate to here, whether it's like a wool sweater or an egg or an eggplant.
We have a program called the Farm to Clinic program, which is with a place called Primary Healthcare in Ames, and it's an affordable clinic. It's a place people can come to just like have walk-in appointments. It's just like very easy access to healthcare for anybody who needs it.
The idea is that the folks who go and are patients at the clinic might have less access to healthy, fresh vegetables, and that might improve their health. So the doctors there will either like prescribe them healthy vegetables, but then also be able to give them the healthy vegetables. So we're sorting them into individual bags, and then those bags are given to patients. So it's completely free of charge, and just another way for us to get healthy food into like the hands of the people that need or could benefit from that healthy food, and just showing that value that food is a human right.
I was working with a faculty member who was in the nutritional sciences program, and we were looking for a research topic, and as a result we were reading a bunch of studies. So we came across one study that had taken the idea of farm to table and turned it into farm to clinic. And being that my other job was working here, I was super interested in trying to implement that here. So the idea was that by bringing fresh vegetables to a local clinic, people were seeing improvements in their, like, less anemia, better hemoglobin A1Cs, which is a measurement of diabetic status. And they were actually measuring the improvements of the participants in the program to see that their vegetable intake was improving their health outcomes. And so while we didn't do the studying of it, we still thought there was great value in doing the program. Are told they need to eat healthy and feel like they can't, then to suddenly be handed the thing that makes you able to do so is really empowering. And in my case, makes my pregnant mamas feel like they're already being a good mom before their baby's even here.
Even seeing like some families who I'm kind of have made connections with in town who get a CSA, and like just being like, I picked that onion, and like seeing it on their counter is like really cool to see it. The food that is grown here out in the wild.
Community aspect of food. If we can have food with people, if we can have food that we love, like if food connects us to our culture, it connects us to our past, it connects us to like the love of each other, and then like again also like that we are trying to grow food with love, and like I don't know if that makes any difference, but like to like hope maybe that like this, that maybe that love ingredient might make a difference.
We're not put here to serve ourselves, but we're put here to live in community and to be attentive to the needs of others. And if we have resources that we can share, or if we have abilities that we can use to help other people, that's what we're here to do.